Welcome, I'm Terry Tropin, and today I'm presenting a lesson on ICD-10-CM coding for diabetes mellitus. Let me tell you a little bit about myself. I have a master's in healthcare administration informatics from the University of Maryland, Global Campus, and have an RHIA and a CCSP certifications. Also, I am a HUMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are basically study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM coding, PCS coding, finally on external cause coding. They are available on Amazon. This is a representation of the relationship between diabetes and insulin. The body needs insulin to open up the cell to receive the glucose. Think of insulin as a key that opens up a door in a cell. You can see, let me get my printer. You can see here, this is the key, this is the insulin. Here's the door to get into the cell. So the insulin opens the door so the glucose can go in. In order to find the right code, you need to answer these questions. What type of diabetes is documented? What complications of diabetes, if any, are documented? Are additional codes required? And what medications or treatments are being provided? So question 1, what type of diabetes is being documented? There are 5 types, 5 categories. We'll start with the 2 for primary diabetes. That means there's diabetes, patient had diabetes, and then they developed another condition due to the diabetes. We have type 1, E10, and type 2, E11. And here's some other words that are examples for each type of diabetes. So in the alphabetic index, find main term diabetes, and then type 1 or main term diabetes type 2. Secondary diabetes is different. This is the patient had something else first, a condition, or was taking a drug, and because of that, they got diabetes rather than they had diabetes, which caused a complication. In this case, they had something else, and that caused the diabetes. So you have 3 types of that. You have E08, which is diabetes due to underlying condition like cystic fibrosis, malignancy, pancreatitis. E09, diabetes due to drug or chemical, could be use of steroids, for example. And E13, other specified, and this is for genetic defects and post-pancreatectomy. If it just says secondary diabetes and doesn't say what kind, you're going to use this one. So in the alphabetic index, find diabetes due to underlying condition, diabetes due to drug or chemical, or diabetes specific type NEC. Sometimes the physician will state that the patient has diabetes mellitus, but won't document what the type of diabetes is. In this case, and if you can't ask the doctor to clarify, the default is type 2. So if you don't have a documented type, you're going to assume it's type 2. This is in the guidelines. Now note here, this is the citation for those guidelines in your ICD-10 book. This is used throughout the presentation. Okay, question 2, what complications are documented? Each of the 5 categories have digits that indicate the complication. And they're the same, almost all the same. They're parallel. So E08 has the same subcategories for complications as E11 and E13. The exception to this is type 1 diabetes, which does not have the digit 0, the 4th digit 0 for hypersomnolarity. So the fourth digit indicates the type of complication. 0, hypersomnolarity, except for type 1. Fourth digit 1, ketoacidosis. Fourth digit 2, kidney. Fourth digit 3, ophthalmic complications. Fourth digit 4, neurological complications. 5, circulatory. 6, other specified. 8, unspecified. 9, without complications. Remember that these are parallel. They're the same subdivisions with the same numbers used in each of the categories of diabetes. Now there are additional digits under each of these, and again, these are parallel. Under hypersomnolarity, there's with coma and without coma. Ketoacidosis, without coma, with coma. Kidney complications, with nephropathy, with diabetic chronic kidney disease, and other diabetic kidney complications. So all of these, the only thing that's different in these is which E code you're going to use. And here's some more of the fifth digits. You have ophthalmic complications, which is fourth digit 3, and then you have the type of diabetic retinopathy, 0.31 to 0.35, unspecified, mild non-proliferative, moderate non-proliferative, severe non-proliferative, and proliferative. Also under ophthalmic complications, fourth digit 3, are digits for diabetic cataract, diabetic macular edema, and resolved following treatment, and 0.39 other. Now notice that the 0.39 says resolved following treatment. If the patient has diabetic macular edema, but it's not resolved, then you go back to the other codes within the ophthalmic section, 31 to 35. So you go back to these. But if it has resolved, use the 37. So that's a little bit confusing. For neurological complications, you have codes for specific type of neuropathy, and then you have amyotrophy and autonomic polyneuropathy. So 40, 44 to 44, and then 49. Now, circulatory complications start with discuss diabetic peripheral angiopathy, without gangrene, with gangrene, and then other. And again, these are all the same regardless of the category. Now, the guidelines state that you should code for all complications of diabetes listed in the documentation. So you're going to do more than one complication if more than one complication is documented. Use separate codes. Code all associated conditions, and we'll talk about those in a minute. And most importantly, never ever report a code for more than one category of diabetes for the same patient. For example, if reporting multiple diabetic complications, all the codes must be in the same category for the same patient, such as all from E08, all from E11, whichever is appropriate in that specific case. You're not going to have one code from E08, one code from E11, one code from E10. They all have to match. Okay, so here's a practice. If you would like to try coding this yourself, stop the recording and select your own codes. Then restart the recording to check your answers. So let me read it first. Type 2 diabetes mellitus with moderate non-proliferative retinopathy and macular edema of the right eye. So turn it off and see if you can can code it yourself. So the answer is E11.3311. So in the alphabetic index, you find diabetes and then type 2 with retinopathy, non-proliferative, moderate with macular edema. The 7th digit 1 indicates that this condition is in the right eye only. Look at how much information is in this one code. That it's diabetes, that it's type 2, that includes retinopathy, that the retinopathy is non-proliferative, that it's moderate and it has macular edema. So a lot of information in this one code. So let's start with question 3. Are additional codes required? Most codes for diabetes include the type of diabetes and the complication. And we saw in the practice that we just did how much information is included in the one code. However, sometimes that's not enough. Some codes include notes indicating that additional codes are needed. It may be a code first note, a use additional code note, or an excludes one note. Most of these codes also state that a Z code for the type of control is also used. This is discussed in the next section under question 4. Okay, additional codes required. Under chronic kidney disease for all types of diabetes, E08 to E13, there's a note, use additional code to identify stage of chronic kidney disease. Under all of the types of diabetes for ophthalmic complication, there's a note, use additional code to identify manifestation of ophthalmic complications such as diabetic glaucoma. For skin complications of diabetes, under the codes for foot ulcer and other skin ulcer, it's use additional code to identify the site. So all of these require diabetes code and another code. And notice that all of them say use additional code, which means the diabetes code is listed first. And then also under other specified, it says use additional code to identify the complication. Now those apply to all of the categories, but there are some special code notes under E08 and E09. E08 is diabetes mellitus due to underlying condition. And this one says code first, the underlying condition such as. And that makes sense, okay? Diabetes mellitus due to underlying condition, well, what is the condition? So you do both of them. And note that the underlying condition is listed first and then the diabetes code. E09, drug chemical induced diabetes mellitus. If it's a poisoning, and you're going to use the specific drug, then the poisoning code is listed first and then the E09. If it's an adverse effect, then you're going to use the E09 first and then the adverse effect. So it depends. These are the rules that they have for poisoning adverse effects. So it's just following those same rules. There are also specific guidelines for reporting secondary diabetes due to pancreatectomy. This is coded to E13. So the guidelines say, and again, here are the notation for the guidelines. First list a code for post-procedural hypoinsulinemia, E89.1, then a code from category E13 for the secondary diabetes, and then Z70.41, acquired absence of pancreas. The pancreatectomy is all or part of the pancreas has been removed, resulting in a lack of insulin, resulting in diabetes. The guidelines also provide instructions for coding for diabetes with the complication caused by insulin pump failure. This could be in any category of diabetes when the patient is using an insulin pump. The insulin pump failure may be too much insulin is released or too little insulin is released. So this is coded, and again, there are specific guidelines for this. Breakdown of insulin pump, T85.614, with the final digit for whatever encounter this is, and a code for underdosing or overdosing from T38.3 category. And then you want the type of diabetes, E08, E11, or E13. Okay, so here's another practice, and we're going to take this here. We're going to go through the questions. The documentations, the questions will help lead you through finding the correct code. Secondary diabetes mellitus due to pancreatic malignancy, snowflake cataract. What type of diabetes is documented? What complications, if any, are documented? Are additional codes required, which you may not know until you go into the book? But it's important to look at that and say, do I need something else? To look for those notes. And then what medication treatments are being provided. So what type of diabetes is documented? Secondary. What complication? It's secondary to the malignancy. What complications are documented? Snowflake cataract. Are additional codes required? In this case, no. And what medications, treatments are being provided? None are specified. So let's wait a minute, and you can turn it off, find the codes, and then we'll talk about it. So the underlying condition, the malignancy, is coded first, and that's the neoplasm. C29.9, go to the neoplasm table and find pancreas. We don't have any more information about the kind of malignancy, so we're just going to use C25.9. Diabetes due to underlying condition, that's E08, and the underlying condition is cataract, E08.36. Interestingly, if you look up cataract and then snowflake in the alphabetic index, it will refer you to diabetes, cataract, the E0836 code. Now, you might have gone through this and found E11.36, but that's incorrect because that's type 2 diabetes. It's really important to keep in your mind which type of diabetes am I looking at. Question 4, what medications and treatments are being provided? This is reported using one or more Z codes. Z79.4, long-term current use of insulin. Z79.84, long-term current use of oral hypoglycemic drugs. Z79.899, other long-term drug therapy. And this one is used for injectable anti-diabetic drugs. Notice it says long-term, in parentheses, current, so it doesn't have to necessarily be documented as current, although it almost always is. Note this, all type 1 diabetic patients use insulin, but some patients with other type of diabetes also use insulin. So the guidelines specifically say, don't assume diabetic patient using insulin type 1. It might be some patients with type 2 use it, some patients with secondary diabetes also use insulin. It depends. So there's a note under E08, E09, E11, and E13. Use additional code to identify control using insulin, oral antidiabetic drugs, oral hypoglycemic drugs. Now, it's important, do not use Z79.4 if the patient is given insulin temporarily to bring blood sugar under control. So these codes are for routine use, long-term use of insulin. If it's given temporarily because of a problem, this is different. This is another code. You would code for the problem, the hyperglycemia, for example. So here's a summary of the diabetic treatments. So if the patient is receiving both insulin and an oral medication, code only the insulin, Z79.4. On the other hand, if the patient is using insulin and an injectable non-insulin antidiabetic drug, you code Z79.4 and Z79.899. So you're going to use two drugs in that case. Two codes in that case. If both oral hypoglycemic drugs and injectable non-insulin antidiabetic drugs are being provided, use Z79.84 and Z79.899. And again, if the patient is receiving insulin temporarily, you're not going to use these codes. There's no way that anyone can remember all the guidelines in your ICD-10 book. So it's really important to write notes in your book to jog your memory. You don't want to be looking through the guidelines, trying to find something. I know there's a guideline on that. I know there's a guideline on that. I just can't remember what it is. You don't want to be doing that during a test or certification exam. Here's some suggestions of things to write in your book to make your life simpler. Turn to the main term, diabetes, in the alphabetic index. This index term goes several pages. So write this, so underline this so that your eye will catch it. Diabetes, due to drug or chemical, due to underlying condition, gestational, out of control, specified type NEC, type 1, type 2. So if you have those underlined, your eye will go directly. You won't have to go up and down a bunch of pages in order to find it. So what about in the tabular list? At the beginning of chapter 4, you can write in the 4 questions that we talked about. What type of diabetes, what complications are there, etc. You can write those in to kind of help you go through the process. Under Z79.4, there's a tip under the code saying about using insulin and oral hypoglycemic drugs. Under Z79.84, there's a tip concerning insulin and oral hypoglycemic drugs. Circle that one. So circle these 2 tips, and that will help you remember. Also, at the beginning of code category E11, write in unspecified diabetes, because remember, this is the default code for unspecified. In code category E13, write in the guidelines or abbreviation of the guidelines or the page number where the guidelines are for coding post-pancreatectomy. If you write those in your book, it'll make a big difference. This completes the lesson. If you have questions or comments, please feel free to contact me. Here is my Facebook page at Coding Teacher, my email at montgomerycollege.edu. I would love to hear from you. If you would like a copy of these slides, just send me a note to one of these and I will be glad to respond. Now remember, I said I had books written on coding. These are available on Amazon, and here's the link. The easiest way may be to go to Amazon Books and type in my last name, Tropin. Thank you so much for listening. Okay, my thank you note. Thank you so much for listening. I hope to have more lessons up soon, and I hope that you found this useful. Thank you.